think that's where the level of the contestation has to happen. And that it's about coalition building and social compacting, where the value bases are around universalism and social solidarity. I think the NHI proposals, and Minister Motsoaledi gives us a profound opportunity to reclaim that redistributive agenda that's historically embedded, I think, in ANC policy since the 1940s. And I think the political education issue, it's about the middle classes now. I think it's about the consciousness of the middle classes and getting the middle classes to increasingly buy into the idea of universal public goods, like, for example, the national health insurance system. I think that's absolutely possible. And I'd conclude that where the foci needs to now rest is to reclaim this historical agenda by talking about establishing a national health campaign. A national health campaign that can bring together social groups across strata and bring the middle class into a coalition that can start to talk to the establishment of a universal national health service in South Africa that the middle class can participate in equally with other sectors of society. And I think if we can achieve that, then we will create the bridgehead to the possibilities of a new kind of South African society, a new kind of inclusive South African society, which we're all struggling and still struggling to achieve since we achieved democracy in 1994. Thank you.
David, if you'd like to continue.
Okay, so I'm going to very quickly cover how we're doing in health, some of the major reasons for our poor performance, looking at issues both outside and within the health sector, and then I want to focus a bit more on some of these key new policies, the NHI and the current approach to implementing it, which is called re-engineering primary health care, look at some of the challenges and opportunities and some priorities. So, how are we doing? Sorry, I've got to get used to... So, this graph, you may not be able to see all the countries from the back, but this plots wealth against health. So wealth is on the horizontal axis, going from very little up to 50,000 US dollars. And on the y-axis, the vertical, it looks at life expectancy at birth. So you will see that some countries are above the line, like Bangladesh. It's doing better than you might expect for its level of wealth. China is also above the line, and the size of the circle is the size of the population. Where's South Africa? As you can see, we are way, way below the line. In fact, our life expectancy would be more in keeping with countries such as Cameroon or Niger. So these are some of our health indicators. And as you can see, life expectancy is extremely low. Infant mortality, that is deaths before 1 year of age, are extremely high. And there are big provincial disparities, 3 times as high in the Eastern Cape as in the Western. Under 5 mortality, similarly, very high, and again, over twice as